News 46. Local coverage you can count on.
At Healthcare Partners Medical Group, our mission is to provide the highest quality of healthcare to each and every patient. With 5 locations in Pahrump, we are local doctors you know and trust. We want to thank you for choosing us. Quality care starts here.
You may recognize this ear, nose, and throat specialist. Dr. Stephen Becker has been coming to Pahrump for 15 years. We speak to him at Healthcare Partners today.
Well, I have a very interesting specialty that involves that part of the body above the shoulders, ear, nose, throat. We work with sinus problems, allergy problems, hearing problems, tongue problems, mouth problems, voice problems. There's a whole host of different problems that my specialty is involved with.
You come out here to Healthcare Partners. Do you have an office out here in Pahrump or Vegas?
Well, I have an office in Vegas, and I come out here to the Healthcare Partners office currently about once a month, but I've actually been coming out to Pahrump for about 15 years.
This is a much-needed specialty, isn't it?
Oh, well, I think so, and I hope it remains that way, especially with the current state of healthcare in the country.
What's the most common symptoms or problems that you see?
Well, in this part of the country, a lot of patients are really bothered by allergies, adult patients, I would say. But for children, it's a lot of ear infections, throat infections. Many children don't breathe properly at night. They snore, they hold their breath, and that's not really normal, especially when you think that these kids who aren't sleeping well are getting into school, and they may have trouble paying attention and doing as well as they should or could do.
Is that some of your specialty, sleep apnea?
Absolutely. I think it's very important for any patient who's being evaluated for sleep apnea to have a complete head and neck examination, and really that can only be done by an ear, nose, and throat doctor.
Do you perform surgeries like, say, for ear tubes?
Yes, that's a very common surgery. In fact, that's probably the first surgery that I learned to do, and I hate to admit it, but that was probably about 25 years ago.
And that is something that you perform on children mainly, right?
Yes, children, but it's not uncommon that adults can have problems with their eustachian tubes, so that can affect their hearing or cause fluid to build up behind their eardrums, and we have to put tubes in the eardrums of an adult patient also.
What's the youngest patients that you work on?
Oh, I'd say probably 4 months to 6 months.
And older patients as well. What kind of common symptoms or signs or complaints that you see in them?
Well, frequently older patients have trouble with their hearing. It's not uncommon that they may have some difficulties with their voice or speech. And sometimes older patients, unfortunately, especially those who've smoked for a long period of time, may end up coming in to see me with pain. And that's always very important to get evaluated, because the pain could indicate that they have a growth or a tumor or even a cancer sometimes.
Do they need to go through their primary care physician to see you, or can they directly go to you?
Well, with some insurances, they can directly come see me, but with others, they do need to see their primary care doctor and get a referral.
And how often do you come out here?
Once a month currently.
All right, so they can give Healthcare Partners a phone call to see Dr. Becker.
Absolutely.